IV medication administration. What is IV medication and why do we use IV medication? These are medication given directly into the vein. They have immediate effects on the patient because it is delivered directly into the bloodstream and it can't be recalled back or slowed down. Therefore, it is dangerous. No margin for error. In this process, small doses are given because it bypasses the GI tract. They are mostly used by post-op or NPO patients. When giving certain medication frequently, it is easier for the patient not getting poked always. Note: it is very important to prime the tubes. No air bubbles. Always complete your 3 checks and 7 right. Imagine giving too much potassium directly to the bloodstream. We all know the outcome. Or giving too much insulin. Always ask for clarification if the dose on MAR and monographs don't correspond. IV piggyback. They are IV secondary infusion medications that are diluted in a small amount of IV solution in mini bag. Through an established primary infusion line, this can be administered by gravity or by IV infusion pump, with the secondary mini bag always placed higher than the primary line. Hypodermolysis. This is the process of infusing fluid into subcutaneous tissues. They are suited for mild to moderate dehydrated adult patients. They can also be used for patients with limited IV access or patients on palliative care. Compatibility of IV medications. When 2 or more drugs or solutions are combined together without causing any harm, they are compatible. Drug incompatibility is a change in drug effect on the body when drug is taken together with a different solution. This can decrease, delay, or enhance absorption of the drug and may be fatal to the patient. Safety tips. Always use the compatibility chart to reduce the chance of IV drug incompatibility. Always use the chart to check if 2 drugs can be given in the same line, and also refer to the monograph for type of diluent for your IV piggyback or what flush solution to be used in between drugs.
Routes for IV medication and CLPNA competency. According to the CLPNA competency, LPN should demonstrate knowledge of routes for medication administration by intravenous. The infusion can either be continuous intravenous infusion, which is the infusion of a parenteral drug over several hours of continuous drip to days. Intermittent, which is an infusion of volume of medication over a set period of time at prescribed intervals and then stopped until the next dose is required. Intermittent IV can be called a piggyback medication, a secondary medication, or a mini bag medication. Bolus. A bolus is delivered directly into the veins through an intravenous drip that allows a much faster delivery, which quickly raises the concentration of the substance in the blood to an effective level. Note: LPNs can only administer Narcan medication through direct IV push, according to the CLPNA. LPNs should demonstrate knowledge and ability to apply critical thinking and critical inquiry throughout the nursing process related to pharmacology and medication administration. Case study. Patient Linda Jones, female, 58 years old, date of birth is October 24, 1947. She weighs 54 kg. She has allergies to morphine. Her medical history is that she has history of osteoarthritis, hypertension, stroke, and atrial fibrillation. Her recent medical history is that she recently fell at home and sustained a fracture of the left hip. She is admitted to the hospital for a hip replacement surgery. She is now post-op and complains of severe pain on a scale of 8/10 to the left hip. Upon assessment, her incision is well approximated and dressing intact with small amount of serosandjunous dressing. Foley catheter intact and drainage 40 mL of dark urine. Her temperature is 38 degrees Celsius, her pulse is 78 beats per minute, her blood pressure is 142/90, her oxygen saturation is 95% on room air, respiration rate is 18 breaths per minute. The doctor ordered for her to have medication IV ketorolac 30 mg IV piggyback every 4 hours.
Step 2. Administer IV medication. Check doctor's order against MARA. Review patient's medical history. Assess the compatibility of medication with the existing IV solution with drug monograph. Check for indications, contraindications, and side effects in the monograph or drug guide. Do your hand hygiene. Prepare medication and label by performing 3 checks and the 7 rights, confirming you have the right patient, medication, dose, route, time, and reason, and also check for allergies. Perform nod and safety check. Check patient's armband against MARA using 2 identifiers, name or date of birth, Assess the patency of the patient's existing IV infusion line. Drugs that are incompatible with IV solution may result in clouding or crystallization of the solution in the IV tubing, which may be harmful to the patient. Assess the IV site for redness, pallor, swelling, and tenderness. Hang secondary bag on IV pole. Clean the tubing port with alcohol swab and allow to dry. Then connect the tubing to the piggyback to the primary infusion line. Then prime the tubing and spike the bag. Fix the extension hook to the primary bag on the IV pole so that the primary bag hangs below the level of the secondary bag. Set the pump rate to be infused. Formula for flow rate for pump is volume in milliliters over time in hours. Run the pump and open clamp to off the secondary tubing. Provide patient stitching. Observe patient for any sign of adverse reaction to the medication and note any patient responses. Sign the MAR and document.